Welcome to the OStudio podcast, where we delve into the art of feeling better. My name is Maddie Lovell, and OStudio is a recovery and wellbeing franchise that's here to help you relax, recover, and improve. Here's something most people don't know. More New Zealanders die from bowel cancer than from prostate or breast cancer. Yet, do you know the signs to look for? Well, today on the OStudio podcast, we're joined by Alice Fitzgerald, the CEO of the Gut Foundation. We've released an episode about gut health already, but today, with Alice, we take a totally different approach. This episode could quite literally save your life. Let's jump in.
Alice Fitzgerald, welcome to the OStudio podcast.
Thank you so much for having me.
Now we have to get all formal, eh?
Yeah.
Yeah.
Got the heart rate accelerate somewhat,
exactly.
you know?
I feel like you've already, you look, you've got a beautiful blazer on. I feel like we're underdressed. I feel like you've already formalised us.
Well, when I arrived, Andy told me, you look very healthy. I was like, thank you. I don't think anyone's ever said that to me, but I will take it.
What a great compliment.
Yeah.
Well done for taking it. Actually, my New Year's resolution last year was to get better at accepting compliments. I always find Kiwis a bit like, they always like, oh, no, this old thing or that thing. And so.
Well, he did then say the OStudio boys also look very healthy.
And then you saw us come in and you're like, hold on a second, Andy. Hold on a second. I thought this meant to be a wellness recovery company. These guys look terrible.
Well, I said they should because, they have this amazing, studio where they can go and float their cares away. So,
You want to look healthy if you're in charge of gut health,
You do. There's a little bit of pressure there somewhat, but yeah.
Hey, look, we've actually already we've done an episode, or recorded an episode on gut health, and it was really, really popular. So it's great to sort of have you back and to be able to talk about this. But I think, like, someone that's come in, that's listening, like, it'd be really cool to sort of understand a little bit about you. So do you just want to maybe talk about your path that sort of led to where you are, and then sort of, on a whole, what are you sort of doing now?
Sure. I'm not used to talking about myself, so that's a bit of a challenge. I actually listened to that episode that you had, and I thought it was fantastic. I guess my path's a little bit different because I don't have a medical background. I wasn't, a clinician. I wasn't working in this space previously. I was actually doing commercial real estate in Singapore 5 years ago, and now I get to go around the country and talk to people about gut health and the gut microbiome and all of that. So it's a bit of a pivot for me. I left New Zealand when I was 19, moved overseas, and spent my time in Melbourne and then Singapore, and then had my son just before COVID. So that was a bit of a incentive to come back to New Zealand, like I think it was for lots of people. And ended up here in Christchurch, started working for the Gut Foundation part-time because my mother was actually running it at the time.
Interesting.
So that's the connection there.
Mm-hmm.
It's funny, Mum and I laugh a lot because she was a global CEO all my life and, worked out of MIT in Boston and had some, incredible roles. And then she actually had a brain aneurysm and sort of gave up the high-flying CEO stuff and decided that she would take on a job that was less stressful. And so she became the CEO of the Gut Foundation. And we laugh because anyone who's ever worked for a charity knows it's not the less stressful option, right?
Yeah.
Because you pretty much go from running a big company that has lots of resources to running a small company that has absolutely no resources.
But high demand as well.
But high demand, yeah. And she was pretty instrumental in driving the Gut Foundation to where it is. We used to be called the Liver and Digestive Diseases Trust. Very sexy name.
Good name change there. It's a great pivot.
So, she took us through a rebrand to the Gut Foundation, which I thank you very much for. And then so I came on board part-time. I had a small baby and I had also started my MBA, and I thought working full-time might be a little bit too much on top of that. So came on board part-time at the Gut Foundation and just got absolutely fascinated by everything to do with the gut. I think 5 years ago when I started, the awareness level in New Zealand was pretty low. I think internationally it was starting to sort of increase. There was a lot of research coming out around the gut microbiome. But here, it wasn't sort of on people's radar yet.
Mm-hmm.
But I started to learn about all that fascinating research that was coming out, but then also how bad the stats are in New Zealand around our gut health, and things like the rate of bowel cancer. And I think I just got very invested in being able to take what I was learning and try and share it with as many people as possible. And I think probably the fact that I don't come from a medical background has actually been a real bonus for me. And, love all the medical community, and we have some fantastic specialists on our board. We're really fortunate. And so, a lot of the information and learning that I get from them is amazing. But whoever's, listened to their doctor talk to them about something, it's probably not the most engaging of conversations. And so I think one of the best things that I can do is take all that sort of information and knowledge and things and try and distill it down as best I can, and then deliver it out in a way that engages with whatever audience that I'm talking to.
Yeah, it makes it seem like we talk
Very
about it a little
similar,
bit.
yeah.
We talk about a little bit being like, you want to be like a translator of the information. There's a lot of complexity, and how can you translate that into be like really digestible?
Yes.
The right word
Don't
to
worry,
use in this context.
We will roll into the puns because they will just keep going.
But I guess that because gut health is it's a real thing that everyone's talking about. I've got two daughters that are 19 and 17, and they're talking to me about it. That was the last thing I was thinking about when I was 19 years old was my gut health and how it seems to impact every area of your health. I guess like just in terms of the gut foundation though, like your role within this, like why does the gut foundation exist? Like what does it actually do in supporting this area?
Yeah, great question. So our, I suppose, aspiration is to be the lead authority on gut health in New Zealand. And that's not an ego thing. It's not because we want to be, at the top. It's because there's so much information out there. There's so much misinformation and disinformation out there. And I think people become really overwhelmed and they go, God, I've heard this thing and this sounds true and let's, go down that path. Oh, but I've Googled something else and it's told me this and that's different. So now I'll go down there, And so I think one of the most important things that we can do is be this this hub of true information that is backed by science. And so we're on this mission to improve gut health outcomes for Kiwis, and that can sound very on the wall floaty, but the purpose is we fund research into disease, and we've been funding research for 32 years, and we've funded about $2.5 million of kind of grassroots pioneering research and medical equipment. So we funded the first ever pill camera in New Zealand, which was pretty cool. Things like hookworm studies for celiac disease, where people infected with hookworms were shown to be able to eat gluten with no adverse reactions. I don't know what you'd rather have, a hookworm or a bowl of pasta, but at least you have that choice, right?
Yeah.
One second, can I just, a little division here, like, I don't expect anyone to have the answer here, but isn't it just crazy how like someone figures that out, like out of like of all the things, or like, hey, let's just try a hookworm and see what it does to this, and if it has any effect on anything, it could, how does someone come up with the idea of like, I've got to, let's do some research and see if, it could be anything. There's probably 1,000 different things you could try, 1 million.
Yep.
Someone's like, what about a hookworm?
I mean, I suspect, and I'm no expert, but I suspect there's probably some quite in-depth science behind it, in that, they're not going out into their garden.
Wasn't just a dartboard on the dart thrown against the wall. Go, let's try one of those. You're probably right. Sorry, I digress.
But I don't know. I don't know. So we fund the research, and we think that that's really important, because if we don't fund research, we will never figure out the answers, and we will never move ourselves along that spectrum of knowledge and learning. So that's really important. But then the other, our other mandate, and the other side to that is delivering education. So, getting the information out to as many people as possible, as early as possible as well, because then it allows people to make informed decisions about their health, and we provide this information and education to a lot of people, because everybody has a gut, so the demographic is fairly broad. So we do education work for primary school kids. We've actually done some education work in preschools as well, which is fantastic, and it's amazing how much engagement you can get around the concept of gut health with 3 and 4-year-olds if you deliver it in the right way, and that's something that also fascinates me, because I love making that connection and getting people to engage with the information. So essentially that's what we do. We fund the research and we deliver the education, and we think that those two things are what will
produce better outcomes. Yeah, fantastic. And I think obviously that's why the organisation's had such longevity and success. But I think there's there's probably people listening, and it's great you don't come from a medical background. I think I agree with you, because I think 99.9% of people listening won't have a medical background either. And I think what's always a really nice place to start, even though we're through now, is how do you explain gut health to someone? It's there's no preschoolers listening, I don't think, but that's
but
always,
there will be parents.
Yeah, but it's it's how do we convey what it is in a really succinct way, a really nice prompt to use on ChatGPT is how do I explain this to a 5-year-old, and it just makes complex things really relevant to you. And so I'm sure how would you explain gut health and why anyone should care about it to someone in a really sort of simplistic manner?
So can I tell you how I explain it to 5-year-olds?
Absolutely.
Go for it. Probably where I need to hear it.
So, and the reason I will say this is also because I have a 6-year-old, right? So I'm right in there, and I know that one of the challenges that parents of small children have is also around healthy eating, right? Even though I don't actually like the term healthy, but eating well, I guess, for your health. And kids go through, picky stages, and how do we get our kids to eat vegetables and fruit and things like that. So when we were thinking about how do we deliver this education around gut health to 5-year-olds, we had an idea which came from that movie, is it Inside Out, the one that has the emotions?
Great movie.
Animated, right? Because I thought that's such a cool concept, and something that kids really resonate with. And so we took some of the bacteria that live in the gut, because essentially what your gut microbiome is just a collection of bacteria and virus and fungi, and it's an ecosystem. So they're all working together to do different things for your body and your mind. And so we took some of that bacteria and we turned them into little animated characters, and then we made some short animated videos, and we called them our gut buddies. So the concept for kids is that, did you know you have this team of gut buddies that live inside you, and your gut buddies need you to feed them fruit and vegetables and legumes, not that we call them legumes, but all these different foods, because that's what keeps them healthy. And when they're healthy, they help you run fast and jump high and learn in school. And so it was essentially saying to kids, here's a little team of pets that live in you, and you have to look after them, right? So instead of saying to kids, you have to eat healthy, because they have no frame of reference for what healthy is, they're like, well, I don't care because I don't know what that means, you know. But if you say, here's some pets to look after, and they're called your buddies, your gut buddies, and they need you to feed them these things, you might like cookies and cake and chocolate and ice cream, and that's okay. But we need to feed our gut buddies first, and then we can feed ourselves. And that's about how simple it is.
I'm going to use that tonight.
Yeah.
Tonight.
And we've had some amazing success with that.
Wow.
You know, so which is really cool.
I actually saw the video on your website, and I wondered if it came from the Inside Out movie.
Did you?
Yeah. It's very similar.
Yeah.
Great idea. And then, I guess, you know, people can say, all right, well, broadly, I can understand that, you know, there's a part of me that's, you know, that if I want to be healthy, keeping that part is healthy. But like, what are, and maybe we should keep the theme of it being like a 5-year-old, but like, what are the consequences what does it look like if your gut's not healthy? Because I think it's like if my arm breaks, it's really obvious my arm's broken, you know, and I think that's the problem with some things like gut health, for example, is if people normalize the results or the negative consequences of something not being healthy. And so if someone's listening, what would it look like to them in a day-to-day life if they didn't have gut health that was their buddies were getting fed healthy foods?
Well, I would ask you both this question, which would be, when did you last check your poos?
I don't even know.
Quantify the level of checking. Like I think is probably
You don't need to get in there with a little spade, but looking, assessing, going, that looks, you know, a certain way compared to how it usually looks. The reason why I ask is because I think that's
a check.
One of the fundamental checks,
Yeah.
right? And it's really important for so many reasons. And one of my, tags now out in the community is the poo lady, right? Because I talk about it a lot. I don't know if I'm allowed to swear on this podcast.
Yeah, of course you are.
Whatever you want.
But essentially, you know, we say we talk shit at the Gut Foundation, or we talk about shit.
Yeah, that's
right?
great.
And talking shit saves lives. And that's not a throwaway line. It's actually, it's grounded in medical research, because we funded a big qualitative study a few years ago looking at the journey from symptom to diagnosis for Kiwis with gut disease. And why we did that was because we wanted to understand where are the breakdowns in the system and also in people's experience. So from when they have symptoms, you know, how long does it take them to get to a doctor? Do they get the kind of, further testing or referrals that they need? And how long does it take them to get diagnosed? Because we know that the longer it takes, the worse the outcomes. And a couple of key findings from that piece of research was that, one, people don't know what to look out for in terms of early warning signs and symptoms. And then secondly, that people just can't talk about it, right? And this inability to talk about poo or digestive issues or anything like that is actually killing us. And I can give you a pretty clear example of that, in that I did an education session for a company up in Auckland last year, and I won't say what their name is, but their health and safety person said to me, Alice, my friend has just lost his son to bowel cancer at 21. And he said, and after he was diagnosed, it turned out that he had been experiencing changes in his poo, and he was too embarrassed to talk to anybody about it. And now he's not here any longer. You know? So when we say talking shit saves lives, it 100% does. And we need to get more people talking about this, and also checking and being aware, because changes from your normal bowel habit is one of the earliest, and sometimes it's the only sign that you have that something more serious is going on. And I have a lot of examples.
What could some of those things look like? Someone out there listening, because if I'm sitting here listening to this thinking, shit, maybe I need to check what's going on. Like, what could some of those things be?
Yeah, absolutely. So first of all, if anyone wants to go onto our website, we have a chart on there. It's part of our Review Your Poo campaign, or hashtag Give a Shit for those who are slightly less precious. And it is a tracking chart. So essentially, we want people to keep track of their bowel motions for 30 days. The Bristol stool chart is on that PDF as well, and the idea is basically to compare what you're producing with the Bristol stool chart, and then just record a number. So you might be a number 3 or a number 4, etc. Over 30 days, we know that you'll be able to get a bit of a baseline for what is considered, I guess, normal for you, but everybody's normal is different, so it's really important to just be aware of yours. One of the examples of that is, for example, frequency. So some people go 3 times a day, some people go once every 3 days. That range is considered medically normal. Now, once you understand what your sort of baseline is, then you look out for change. And change can be things like colour, frequency, texture, and all of that information is on our chart as well. And when we talk about change, it's sustained change. So something that continues to happen for, say, 2 weeks, 3 weeks, that's when you need to be getting to your GP. It's not, and I do a lot of work in construction, so I say to the guys, it's not you go out on a Friday night and have 17 beers and Saturday morning things are looking a bit number 7, a little bit sloppy, It's that sustained change over sort of 2 weeks.
Yeah, I see.
And the other really helpful thing to do is that if you are doing that tracking chart, keep it, take a photo of it on your phone, and then have it on hand so that if you do see change and you go to your GP, you've actually got some evidence and some data that will help you along the pathway to getting further testing. Because one of the things that I hear a lot doing this job is that people go to their GP, and because they turn up and say, "Oh, I've had dodgy guts," or and the GP says, "Oh, how long for?" "Oh, I don't know, a week or so," or could be 3 weeks, could be 4 weeks. We're all so busy that unless we're writing things down or keeping track, we don't really know. And so then, you might get sent away, and your doctor might say, "Oh, keep an eye on it for the next, month or so," and you're already a month delayed to a diagnosis if you might need it. So
yeah, you talk about just the challenge of talking, of having these types of discussions. Like even before, when you asked when was the last time I lied, I know exactly when it was really, because I had some issues. Like I was bleeding, it's like a lot of blood.
Yep.
And I was like, what's going on here? And it was like a week passed, and Laura's on my case. So what are you doing?
Yes.
Like, what are you actually doing, Tim? Go and talk to the doctor. And for me, internally, I was like, there's got to be an issue here. I can solve this. It's just this crazy thinking back now. But went and got checked.
Yeah.
Colonoscopy.
Yeah.
One of the the experiences that that was an experience in and of itself. But all clear, you know what I mean? And just knowing that I'm sweet, like that feeling of like, shit, there's something I'm nervous about something here, to actually things are fine, that whereas it could have been the opposite. It could have been
100%.
like, as you mentioned, a 21-year-old dying of bowel cancer. I had a good friend of mine who died of bowel cancer as well, and he would have been in his early 20s, mid-20s. And, there's more and more of that happening. So I think, it's just you've got to have that sort of that mindset of,
we've got to break down the stigma, right?
Yeah.
We've got to do that. And that's, I think that's where humour comes in. Like humour is so important, right?
That's so true.
And I go out onto construction sites and I'm in boardrooms with, fund managers, and it doesn't matter. Everyone loves a poo joke, right? That is an across the board thing. And that's what we try and do at the Gut Foundation, is use as much humour as possible to break down those barriers, because if you can get people laughing, you can get people talking about it, right?
So
and
true.
you said you lied, right?
Yeah.
But then we've spent some time talking about it, and then you've gone, actually,
Humour definitely helped. Like with the colonoscopy itself as
well. Yeah.
You know what I mean? It was just like there's something anyone that's had. Have you had a colonoscopy before?
No.
It's one of those experiences that you feel, for me personally, it was like, it just felt like it was like, this is one of the more
Fairly
invasive,
invasive,
like
right?
vulnerable.
you're in this
Yeah.
sort of fetal position and
Yeah.
you're just like, someone just rip me out of here because this is horrible.
Well, so
But at the same time, like leaving, I was just
Yeah.
like, thank God for
Yes,
that. Like
right.
it was worth it. You know what I
Yeah.
mean? It's because once again, like I want to be around.
yes,
You know, I want to be
you've
there
got
for my
kids,
daughters.
You've got
you know,
a partner.
I
you
care about
know?
my health.
Yeah.
And I know the importance of it. Like
Yeah.
as sort of said before, we had Pete Smith on here talking about the importance of all this stuff.
Yeah.
But even then, like that's what I was sort of thinking as you're talking about,
Yeah.
like education being a big part of what you guys are doing, but normalization of it and making
Yeah.
it palatable and talking. You can talk about it and that it's normal humor. I can see
Yeah.
why that is needed because once again, you know, my story is not abnormal. Like most guys I speak to about any of this, it's like, oh, you know, no, don't go anywhere near there.
And yet men are disproportionately at risk from bowel cancer, you know? So every day in New Zealand, 9 people are diagnosed with it. 3 of them die and 2 of those are men. And one of the things that people are often shocked by is that bowel cancer kills more Kiwis every year than breast and prostate cancers combined. And yet we look at the profile that breast cancer has and pink ribbon teas and, you know, things like that, Movember, you know, and yet we have this...
It's all stigma, isn't it?
We have this stigma, you know, and we have some of New Zealand's top gastroenterologists on our board, and our vice chairman, Professor Richard Gary, he said, it's like, you know, for us, it's like looking at someone's knee. You know, he goes, there's no difference to the medical profession in terms of, you know, we go, oh God, we don't want to go in and, you know, have something poked up our bum, you know. They're like, we do this every day. It's not a big deal, you know. And I think it's so important for people like yourself to share this because the more people share it, the more normal it becomes. And that saves lives, right? Talking shit saves lives.
Yeah, and I think you're right. So I think there's 2 ways you can help change the outcome, right? And so one is by making it easier to talk about, making it easier to discuss, encouraging people to, you know, want to go and do it sort of, you know, I'd say voluntarily. The other way is with a bit of fear. And I think not in a malicious way at all, but like understand the consequences also drives action, I think, as well. And maybe that's, you know, that's why Laura was so on you about it, because like we understand there could be some serious consequences here. And so I think that's a really good area we've talked about. Like, but what are some of the consequences? And I think, you know, there's some really interesting stats on your website, which I've got written down as well. But like, and you've just talked about some. But like, what is the flow-on effect from someone who's got an irregular poo or for a sustained sort of, you know, 2 or 3 weeks?
Well done on saying poo.
Yeah. So say shit. And so like that person, like if we think there's someone in their car or at the gym at the moment that for the last 2 weeks has noticed something different, like why should they ring a doctor today and book an appointment rather than wait? What are the risks of them waiting?
Oh, I mean, the risks are really that it will spread. And, you know, if there is something wrong, and, you know, I can give you an example. I had a site manager that I worked with in Wellington who shared his story as part of our education sessions, and he was 32 and working in construction and noticed he had severe constipation, and this had gone on for sort of 3 or 4 weeks, and eventually went to his GP, and his GP gave him a little pot to do a stool sample, and he took it home and he put it on top of the fridge and he forgot about it, right? And I always like to clarify that he hadn't actually done the sample before he put it on top of his fridge. That's important. And then it took him another sort of 3 or 4 weeks before he went, oh, this is not getting any better. Went back to his GP, got booked in for a colonoscopy and found he had a stage 4 rectal tumour. They had to cut so much of his colon out that he now has a colostomy bag, which is the bag that you wear on the outside of your body that collects your poo, which he'll have for life. And 4 years after that, they found a spot in his lung, because that's often what happens with bowel cancer, is that it metastasizes either to your liver or to your lungs. And they cut out that piece of his lung, and luckily this is sort of I think about 10 or 11 years ago, and he is still here. He's cancer-free. He's healthy. But a couple of things on that is, one, if he'd gotten in earlier and he'd done his sample as well, maybe had a little bit more fear, would he have a colostomy bag? Don't know. That's one of the questions he said to me, Alice, I don't know if I'd acted sooner, would I have this for the rest of my life, I mean, secondly, depending on that timeline, he could have, stopped that progression to his lung. But then, on the other side, if he'd lengthened that time frame, maybe it would have spread more. And I guess another couple of scary things around this are that we often have this perception that it's an older person's disease, right? And it's absolutely not. In fact, in New Zealand now, we have the fastest growing rate of young people, so those under 50, who are being diagnosed with bowel cancer in the world. So Professor Frank Frizzell, who's one of New Zealand's top colorectal surgeons, he said he likens the speed of young people in New Zealand getting bowel cancer to that of a Ferrari. We have never seen this kind of rate of increase. If you look globally, by 2040, so 14 years down the track, the rates of new cases of colorectal cancer will have gone up 63% globally, and the rates of deaths from colorectal cancer will have gone up 73%. Even if you look at things like inflammatory bowel disease, gut disease in general, from 1990 to 2021, the rates of inflammatory bowel disease globally went up 88%.
Yeah.
And these numbers, people hear them and go, oh, that doesn't sound good, but it kind of doesn't resonate, I guess, as much. But, if you went into your boss tomorrow and you said, and they said, I'm giving you an 88% pay increase, well, you'd be pretty blimmin' stoked, wouldn't you? That's a big number when it's a good one. I think when it's a bad one, people try and tend to block it out. But I would say anyone who's listening to this, who's, especially if you're under 50, if you notice sustained change in your bowel habits, then get yourself to the GP. Because if it's nothing, it's nothing, right? But it's relief, and if it's something, don't delay. We all know the state of the healthcare system at the moment, right? Don't delay that time frame to diagnosis any longer if you do need one.
Yeah.
And so I mean, I think it's really interesting talking about this because we're not really talking about, like, in some of the past conversations we've had around gut health, it can be more how it's affecting your day-to-day life, your ability to perform, that kind of stuff. Whereas you've really hit the nail on the head, is that, like, the probably the greater consequence of not looking after your gut is cancer somewhere in your system.
Yeah. And we live in a country with the highest rates of bowel cancer in the world. So it's something that we as Kiwis should really be aware of.
Why do you reckon that is?
The short answer is no one knows. That's probably the question that I get asked most often. And I think that also really points to why we fund research, because we need to find out those answers. I know that Professor Frank Frizzell has quite an interesting hypothesis around microplastics and their effect on the lining of the bowel, amongst other things. I would say, and again, don't have a medical background, but I think the change in diet is quite significant as well. I think our consumption of ultra-high processed foods is, an area that we will see more and more revelations out of. But I think, one of the things that we always like to give people simple things and practical things, right? Because yes, you can go out and scare people, but then you also have to say, well, on the positive side, 90% of bowel cancer is treatable if you catch it early, right?
Yeah, wow.
It's one of the most treatable cancers. So get yourself the information, be informed, have good chats to your GP, have good chats to your family and friends, right? Normalise gut talk, normalise talking about all of this stuff. On our website, we also have a tracking chart for kids called Super Poo, Look in the Loo, because kids love poo, right? I have a 6-year-old boy, so I talk about it at work all the time, and then I talk about it at home all the time, you know, and that's a good thing. And so get the family tracking their poo together, right? Kids love poo, they love sticker charts, make it a family exercise.
Laura is going to love this.
Right?
She's like, Laura, we're tracking our poo.
Yeah.
What might actually, because I think like I'm trying to think in my head, like what's the barrier of someone going to do something right? And I think like if you're open to talking about it, Tim, I think like I'm thinking like really practical, like what does it cost? You know, like someone like it just doesn't, you know, is it a it's clearly not like an ACC thing. Like, does it take 8? You know, because I think sometimes when you're busy, it's like effort is probably the thing that you're concerned about. You're like, oh, I've got to go to the doctor, and then they're going to say do this, and then it's like I've got to ring that person, and you know, like, and it's just like, you know, what's actually I've got, you know, kids, and I've got a job, and I'm trying to manage all this stuff, and so like. Practically, what is the process?
It's well, I think it's a good question.
Yeah.
Like, because for me, I can only speak from my own perspective, but firstly, I'm justifying why it's the case. You know, I've been lifting a little bit more. You know, like there'll be a reason. You know, like I've had it before. Like you know, I had that many anti-inflammatory pills while I was playing rugby that, you know, just to get through the weeks, I burned a hole in my stomach, you know what I mean? And so I knew that there was some damage in there already. It's like, oh, this probably flared up. So all these justifications on why it was the case was the first thing. Secondly, it's exactly as you've spoken about. It's like, I don't want to have to just deal with this. I've got so much going on at the moment. Like having to even just book an appointment to go and spend 30 minutes with a doctor is just like, there's so many more important things to do. You know, it feels like that could be dealt with later on. So that'd be a secondary thing. Definitely the embarrassment side of it. It just is. And just like, just that whole area. It's just like, I don't want to have to go and talk about this, you know. I know they're going to have to put their finger up my ass and like figure out what's going on. It's like, I don't want that, you know.
Yeah.
And so the embarrassment definitely comes into it. There's probably a little bit of, I don't know, for me there was probably a little bit of fear. I don't really want to know.
Yeah.
I don't really want to know if there is something here, because then it's going to be a bigger issue that I'm going to have to deal with, which is, I don't know, even saying that out loud is crazy.
But so normal.
Yeah, I agree.
So
I
normal.
agree.
Yeah.
Yeah. But yeah, so I think it's a combination of all those things together just means that actually that little box can sit there and I'm carrying on over here.
Yeah.
You know,
so essentially you book a doctor's appointment, ask for a referral.
Yeah, well, literally just book a doctor's appointment.
Yeah,
then it's like then the process. It's like the temp and bowl it's like off the top of the hill and it's on its way down, because then it's like no, you need to go and have this. You know, you need to get this done. And so then that gets booked and it's in the diary already, and I can't not. And then turn up and say, cool, I'm going to have to do a proper thing.
Yeah.
And so you just follow the process. I think literally it is really simple. I know that sounds silly, but it is just book a doctor's appointment.
Yeah.
And then follow the process.
And I think, you know, one of the important things to take note of as well is that, you know, we're all probably in very privileged positions in terms of our healthcare, and, you know, we are able to go down that pathway a lot more easily than a lot of people, because, you know, in the public system, there are very, very long wait lists for colonoscopy. So the ability to actually get a colonoscopy in New Zealand, depending on where you live and your insurance and all of that.
Is it fair to say that all of that is outside of the individual's control? Like that's up to people like yourself to push and try and get more access to the stuff, more spaces available. But from the individual's perspective, it's like that's all out of my control. All I've got control of.
Just get to your doctor.
Just get to your doctor.
Yep, get to your doctor.
If that's 2 months, if that's 6 months, if that's 12 months, you can't control that. What you can control is what you're choosing to do about any issue that's there.
The other thing that I would also bring up is, so we educate a lot on what the options are for diagnosis. So most people, if I walk into a room and I say, who's heard of a colonoscopy, maybe, depending on the audience, between 60 to 90% of people will put their hands up. if I went in and said, who's heard of a CT colonography? I'd say most of the time, no one will put their hand up. Do you guys know what a CTC is? Yeah. So this is my experience. It actually blows my mind a little bit because we live in a country with the highest rates of bowel cancer, and yet nobody knows that there's another option for diagnosing bowel cancer other than colonoscopy. So CTC or CT colonography is essentially a scan. So what happens is it's the same prep as a colonoscopy, so you have to drink the stuff that cleans you out. And then instead of putting, 1.8 metres of endoscopy up your bum, which, as you say, Tim, was fairly invasive, did you stay awake? Or
I did, yeah.
Good on you.
I could go and leave the whole story in that too, which is like...
I just want to make a comment so bad, but it's just not appropriate.
Well, I'm going to say it because we're talking about it. But I'll let you carry on your story though. Yeah, go.
So instead of that sort of invasion, what they do is they put a thin plastic tube about this far in your bum, and they
it's about 2 inches for anyone listening.
Yes.
Yep.
And they inflate your bowel with gas, and then they put you through a CT scanner, and it takes images from sort of your collarbones, I guess, down to the bottom of your pelvis. And why that's good is that it also sees all the surrounding organs, and about 10% of the time they actually pick up on things that they weren't looking for. The difference between them is obviously that with a colonoscopy, they can actually snip out the polyps when they find them. With a CTC, it's a scan. Now, with CT colonography, it's easily accessible because we have capacity. It's minimally invasive, right? So it's, 2 inches compared to 1.8 metres. And if you're paying for it yourself, it'll cost you about $1,200. So when I talked, at the start of this about people being able to make informed choices, this is a really important piece of information to have, because first and foremost, if you don't know, you can't ask, right?
Mm-hmm.
So you can't go to your GP and say, I know about CTC, I'd like to get a referral, I want to have one of these, right? So the first is know what your options are, and the second is if the idea of the colonoscopy is off-putting, which it probably is for the majority of people, then this is another alternative. Now, if they find something, you do have to have a colonoscopy.
Mm-hmm.
But if you don't, if everything's clear, like it was for you, Tim, then happy days, right? So that's another big part of what we educate on is knowing you're normal and then knowing what your options are as well.
I just want to add to, because we talked before about like just going to the doctor, and I learned this from Kate, who's our franchise owner from Wellington, but like you still have to be your own advocate in the medical system, I find. Like,
100%.
and I that's one thing I really,
Good call.
it's like, doctors are human beings too,
Yes.
And they may have had a stressful person before you, or a busy afternoon, or
just hugely overworked.
Yeah, whatever it is. And no judgment on them, but like, if that's what you want, then you can just say, I get it. Like you pray I don't need it, but I just want one. And I think that's I've got a friend who is a radiographer, and so her whole world is people that have got cancer. And so of course the lens that she looks at anything from is like, oh, this could be cancer with herself or a family. And so she went to a doctor and was like, and the doctor said, I don't think you need it, but you just want one. And she said, yes, I want one. And so she went, it's like sometimes you've got to just...
You have to advocate.
Yeah.
You're so right.
Good
like,
point.
Maddie, that's such a good point to make, because, I say that a lot when we're doing toolbox talks in construction, because it's predominantly men and they don't like to go and get health checks and things like that. But I'm like, you guys work really hard. You pay your taxes. Go and use the system. Go to your doctor, get what you need, save your own life, be there for your kids, be there for your partner, because the alternative is really scary. And I think if you're not getting the answer that you need, and GPs are wonderful, and in my opinion, one of the hardest working medical professionals that we have, right? But so overworked in lots of areas around New Zealand. And so if you're not getting the right answers for you, it's no disrespect to GPs, but go and get a second opinion, right? And advocate for your health and push. Because in this line of work, you can imagine how many stories I hear of the opposite, you know?
Well, even like the guy that put it on the fridge, you know, it's like, it's kind of almost emotionally feels like you've taken a step and you get to that. It's like there's a bit of personal responsibility as well. And I don't want to downplay that when we're talking about, you know, you go to your doctor and then it's sort of the ball's pushed and they'll take everything else. I think it's just, you know, like it's still your responsibility. Like if they've given you a test to do, if they've given you the check your poo, review your poo, you know, thing to be doing for the next month, it's like you have to do it.
Yeah.
Can I add something in here, which I think is important, because what we're talking about, I agree with 100%. It's like personal responsibility. You need to take action and you need to prioritize your health. You need to understand that you want to be around there for your kids, etc., etc. Like, but what we're all really wanting here is the outcome to change. We want someone to actually take a step in. I honestly don't think I would have gone unless Laura was like pushing me.
Yeah.
So like the flip of this is like, yes, increase your personal responsibility, but if you're a partner out there, you can probably have the most impact on this, you know, more than the individual yourself. Like if Laura's sick, in my mind, nothing's more important. Like she needs to be looked after. Like I'm making sure that that's done. She'll find reasons why, you know, this is okay. And I think we're all like that. We're all got a little bit of that internally where it's, no, I can get through this, you know, whereas you're the one that you love the most, you know, like, so I would almost, you know, share that responsibility, you know, where it's like, yes, personal responsibility, but partners have a big role to play here, I think, in encouraging people to take better action in everything, you know, whether that be the way that they're eating or the way that, you know, they show up at a doctor.
Yeah.
But I think we can help each other here in relationships.
I think you're so right. And, you know, we're gonna run a big health campaign in May, and it's, you know, the calls to actions are all around checks, right? So the campaign is going to be called Gut Check. And there are 3 checks, so a self-check, which we've probably talked about a lot today, a professional check, so getting the facts, understanding, you know, what the options are, and then the third one is a social check, right? So it's that having that conversation, it's pushing people to go and take care of themselves if you think that there's something they need to take care of. It's also you know, if you've got family and friends that are eligible for the Bowel screening program, for example, are they doing it? Right? Because, you know, I've been in situations where I've given gut health talks and then I've had a conversation to somebody who said to me, oh yeah, I got one of those bowel screening kits, you know, and I'm like, have you done it? And they're like, oh no, not yet. I'm like, you've literally just listened to me for an hour, you know, about this stuff. So it is that pushing, you know, pushing people that you care about to go and check themselves out. I think that's really important.
Just book it in.
Yeah. Yeah, and
I think Laura she did. She booked the appointment.
Yeah, and I think on the CTC, I mean, I've had one. So, you know, my email's on the website. If anyone wants to send me an email and say, you know, hey, can you give me some more information about this? I'm always happy to do that. As I said, we're an information hub, and we're going to give you the right information. So come to us with any questions. But secondly, you know, for any Kiwi blokes out there, I actually rang our ambassador a couple of years ago, Mr. Scott Robertson, and there's not many ambassadors that you can call up and say, hey, Razor, people are dying of bowel cancer. Nobody knows what CTC is. Could we put a small tube in your bum and film it for educational purposes, you know? And he went, sure. So that video is up on YouTube under the restricted section. Just kidding. There's no nitty gritty. But, you know, so he did that because he was like, I need to encourage more men to book it in, do it, you know, and get that check, because it's unfortunately our wonderful men in New Zealand who are not making that move. So
yeah, what else like is literally reviewing your poo the only, well, let me rephrase this. Is inconsistent, you know, poo the only way that someone's going to recognise that something might be wrong? Like, is there anything else that, like, I don't know, like, is it aching in your stomach? Like, is there, or is it literally like?
Yeah, so I think all of those things. So those are the more obvious things. Like if you have pain, you know, that is, you know, doesn't go away or is unexplainable. Obviously, if you see blood as well, you know, you did, Tim, but that doesn't necessarily mean you've got bowel cancer. And I think, people freak out about that. That can be because you're constipated and there's tearing, things like that. But all of those things are things to be aware of.
Mm-hmm.
And I know that we've spent this whole time talking about poo and bowel cancer, and what we do at the Gut Foundation is very much focused on the health side of things as well. So I would say a really important preventative action that people can take is to check how much fibre they are eating every day, right? I usually say to people when I'm doing education sessions is that if they take absolutely nothing else away from what I tell them, 30 grams of fibre a day is the one thing that they can implement that will make a massive difference to their health and well-being, because it ticks so many boxes. So if you are eating your 30 grams of fibre a day, and most of us are eating 10 to 12.
What could that look like? What could 30 grams fibre?
So let me circle back to that. But if we're eating our 30 grams, we are decreasing our risk of bowel cancer by 30%, which when you live in this country with the highest rates, that's a pretty good number to be aiming for. It's also, and when we talk fibre, we're talking prebiotic fibres, so your plant fibres, fruits, vegetables, nuts, legumes, seeds. They are the fuel for your gut buddies, for your gut microbiome, right? So that's what they need to fuel the rest of your body. If you don't feed them that fibre, they will start to essentially cannibalize the lining of your gut, right? And then you get inflammation. And inflammation in your gut is obviously a very nasty thing to have, but it's also linked to your mental health, because inflammation in your gut can show up as symptoms of depression in your brain. So when we say eat your 30 grams of fibre, you are creating physical well-being, you are being preventative against disease, and you're also helping create good mental health and mental resilience. So it's kind of that one-stop shop.
Mm-hmm.
So in terms of 30 grams of fibre a day, I mean, that will depend on, obviously, everybody's preferences in terms of eating. For me, I'll give you an example of what I would have for breakfast, because fibre is really important, but so is diversity. So the sweet spot for gut health is 30 plants a week. Do you guys reckon you eat 30 plants a week? 30 different.
Oh, 30 different.
No way.
Oh,
No way.
If you think about it, like, because there'll be different types of stuff in one meal. There might be 7 different types of plants in one meal. If you think about like a spaghetti bolognese or something, you might have
like a vegetable stir fry with mixed vegetables, or
30 different stuff.
But then like an apple, an orange, banana,
Yeah. I think the Pareto principle really applies to like what people eat.
Yeah.
Like 80% of the time, you eat the same 20% of things.
Yeah. 100%.
Yeah. And I think like I would eat 30 absolutely. Yeah. But like most of them would be bananas, apples, berries, spinach.
Yeah.
Probably.
Because we're all creatures of habit, right?
Yeah, totally.
So we go, I'm going to be really good this week. I'm going to have a salad every day. But chances are we're having the same salad every day, right? Yeah. I am a little, I guess, hack for diversity that's helped me, because I've never been a breakfast person. But what I do is I have a bag of frozen mixed berries. So if you're going to buy, frozen fruits and frozen vegetables, which are great and, equally as valuable in terms of nutrition as the fresh, sometimes more so, buy them mixed, right? So I will have, mixed berries, I will have some probiotic yogurt, I will have a bit of granola, and then I have what's called a diversity jar. So it's a jar, and it's filled with all these different nuts and seeds and grains and things like that. So there might be, 9 or 10 different plant fibres in that one jar, and all I do is just take a couple of tablespoons of it and put it on my breakfast in the morning, and I've probably got like 5, I think there's about 5 different berries in that bag of mixed berries, and then you might have the 9 or 10 different things that you've got in your jar, and you're already at 14, 15 different plants, and you've only had one meal.
How much fibre does one apple have? Do you know? Off the top of your head, once again, I hate to put you on the spot, but I'm just trying to quantify like 30 grams.
I actually don't know. That would be a good one for Google. I think a banana is like 1.8 grams.
Oh, wow.
Yeah.
Yeah. Bananas, like it's more the crunchy, like, food, like carrot. Is that a misconception?
So with bananas, this is another really good kind of simple thing, is it always eat your bananas slightly greener.
Mm-hmm.
Now, not pure green because that's, you know, but if it has that tinge of green, it is still a prebiotic fibre. So it's the type of fibre that we need to nourish our gut buddies. Once the banana goes yellow, the fibres have converted into sugars.
Yeah.
It's still a healthy thing to eat, but it's not doing the same thing for your gut.
Interesting.
And I think that's a really simple way of explaining the difference between gut health and healthy eating.
Yes.
Because if we all talked about what we think is healthy eating, I bet we'd all have different opinions about it, right?
Mm-hmm.
So that's why I don't like that term healthy. But in terms of gut health, it's about those prebiotic fibres. And if you go to the supermarket and choose greener bananas, it doesn't cost you any more, right? It's an easy decision to make, but you already know that you're doing something good for your gut.
Got ya.
Yeah, I have just looked it up. And so a banana has about 3 grams of fibre.
Even more.
An apple's a lot, I think, from memory. I think it was...
Apples are actually one of the best fruits that you can eat for your gut.
Yeah.
Because I'm even sure, I'm not promoting this at all, but doesn't even like Weet-Bix say they're a great source of fibre for kids. I'm sure they promote that. Apple, about 4 grams.
Interesting.
Do you know
grams, it's a lot more than I would have thought.
Do you know what's really helpful? ChatGPT.
So good,
Put
That's what I'm
in
doing now.
30 grams.
Yeah.
Like, give me a meal plan. This is what I like. This is what I don't like. Give me a meal plan for 5 days for 30 grams of fibre a day.
Yeah,
Easy as.
that's exactly what it's sort of done to me. It says breakfast rolled oats, 1 cup is 4 grams of fibre. Chia seeds, it says 2 tablespoons of 10 grams of fibre.
Yep.
Raspberries, 1 cup is 8 grams, and that's a total of 22 grams just for breakfast.
Yeah.
Lunch, it's just saying add on half a cup of black beans, which is 7 grams. Then you're at 29, and then it said another way to build it across the day, like half an avocado is 5 grams, a cup of broccoli is 5 grams, 3/4 of a cup of lentils is 11 grams, apple with the skin, I don't know who has it without the skin, but that's 4 grams, nuts and seeds, a small handful, is 4 to 5. So there's definitely
it's achievable, isn't it?
Yeah.
a broad way to do it.
Absolutely. And I always think, gut health is not about, chia seeds and goji berries, which I think people get turned off because it's very health influencer, but it should be green bananas and chickpeas, and there's an absolute myth that eating well for your gut is expensive, because it's not. Those foods that we've just been talking about, apples, bananas,
Yeah, it is, and I always feel, the whole like what to eat and how to be healthy is quite a polarizing world out there.
Yep.
Like especially with the way social media sort of now can be, and like you want to eat, the gut health expert like you is sort of like, hey, prioritize fibre, and then like someone who's I don't know, focused the carnivore diet, it's like, hey, this really helped me with a skin condition, like don't eat anything but meat. And it's sort of like it can be really tough as a consumer and a consumer of information to try and figure out sort of like what is the best thing like for me right now overall. Like I want to have good skin, I want to have good gut health, I want to have healthy heart, and like what are the there can be lots of different things that influence. And so we don't have an answer. I'm just saying I just empathize because I'm one of those people that sees that you should eat a dozen eggs a day, and then all of a sudden someone's saying that you shouldn't eat eggs at all, and then
eggs are great. From a gut health perspective, eggs are great. I think if you go on a certain eating plan, that because you've got a condition of some sort, like you're doing something for your skin or to lose weight, you will see results from that, right? In terms of gut health, I guess the easiest way to explain it is diversity, right? So you want to have as many different species of gut bacteria in your microbiome as possible. And so the way to do that is to eat as widely and diversely as possible. interestingly, in the US, I don't know if you've seen, but they've basically flipped the food pyramid.
I did see that, yeah.
Yeah. So
What are your thoughts on that?
I think that's absolutely great.
Yeah.
Fantastic,
Yeah.
you know?
It's been a long time coming, hasn't it, really? Yeah.
It's quite incredible, the history of that. But anyway,
Right, isn't it? And this is the really fascinating thing around research and just the way that knowledge develops over time, you know, and what we know about gut health and the microbiome now, you know, in 5 years' time, what we know will be exponentially greater, you know. So I think it's really exciting. I think it's, in terms of, I guess, the ability to produce treatments for different diseases through a focus on the microbiome as well. I think that's really fascinating. And I also think, you know, it's a message of empowerment for people, because it means that we're not this genetically pre-programmed list of, you know, diseases and medical conditions, which I think a lot of people worry about. But we now know that by, you know, changing your microbiome, which the easiest way to do that is through what you eat, you can act really preventatively towards a lot of those different diseases.
What about other, like, lifestyle factors? Does that influence gut health as well? Things like exercise, smoking, like, or is it just food?
No, absolutely. So, you know, interestingly, I think there was a research study done at a university in Boston, I think it was, and they looked at, they compared the microbiome of, you know, ultra marathon runners and rowers, and basically those two different groups had different groups of bacteria inside them. So there's a whole lot of research going on as to the influence of different bacteria on your ability to do different exercises and to compete in different sports, you know, and to perform. So the opportunity that exists to, I guess, create,
fine-tune your
or
specific,
inoculate people with the bacteria of, you know, ultramarathon runners so that they can perform like that. I mean, I find that fascinating, you know, but I mean, yes, so exercise, absolutely. When you exercise, you actually increase the diversity of your gut microbiome. They've done research into, I think it was Chinese monks and meditation habits on the gut microbiome, and found that the meditation actually increased the diversity of the gut microbiome.
It's incredible.
Which is also mind-blowing, right? Because it's essentially people are thinking bacteria into existence. You know, I find that very, like, you know, it's crazy. And I mean, this is all kind of, you know, it's a wee bit out there at the moment.
But it's not, though.
It's physiological change is what happens from doing something like that. And so, like, it makes sense, right, that if there's something you can, because it's not, thinking is a part of it, I guess, but it's like the results can be physical and obvious, and so that you could see how that connection could then have.
And you just see the flip of it, you know. I mean, like when you're highly stressed, you know,
oh, absolutely,
and the impact that would have.
Because your gut and your brain, and you know this from, you know, your previous episode, but your gut and your brain are connected physically by your vagus nerve, chemically, hormonally. And out of the 100% of communication that's going on between your gut and your brain, 80% of it is flowing upwards from your gut. Yeah. You know, which is incredible. I think on the whole, what we were talking about with, you know, diet and, you know, it's interesting from a microbiome point of view, because we have this whole paradigm around calories in and calories out, right? And that's just been so embedded in what people know about weight loss. And yet, you know, research has shown that people who are overweight have a disproportionately higher ratio of something called Firmicutes, which is a particular gut bacteria. And that bacteria is really good at extracting as much energy as possible from the food that you eat. And so your body hangs on to that energy, and which means that you essentially gain weight. So this whole idea that it's just calories in and calories out it's far more complicated than that.
Yeah, we actually had a podcast that would have been released a few weeks before this episode around weight management with Pete, who did the last one, and he talked a lot about that. There's a lot of system foundational understanding now that if that's not right, the calorie in, calorie out isn't as simple as it once appeared.
Yeah, well, they did this. I love all these research studies. So they did this one where they got 2 mice, and they. Do you know what a poo transplant is?
Oh, yes, I have heard of the bacteria from there gets put into the stomach of another.
Fecal microbiota transplantation, or poo transplant for short. But it's essentially taking a microbiome sample of somebody and putting it into somebody else. But with this study, they actually had the microbiome of 2 identical twins. So one was skinny and one was obese. And they put those 2 samples into 2 mice, and then they fed the mice exactly the same foods, the same amount of calories, everything the same. But what do you think happened?
The big ones.
Yeah, one mouse got big, and one got skinny.
This is it's like the best thing about this, but also the biggest challenge in this whole space is it all comes back to hyper personalization. Like it really does. It all comes back to the individual all the time, and the best thing for one person is different to the best thing for the other. And we're always trying to find like silver bullets and reasons why that hey, do this, eat this, 35, this exactly this will do it. But I also think as well, even with our messaging, because what we're talking about here is we're wanting people to make behavioural change and we're wanting them to take action on things. But the way that you do that is completely different. Like, if I start talking about bowel cancer with my daughters, they're like, what? Snore. You know what I mean? But I start talking about like their skin health and their hair and the way that the energy and the way that they feel, it lands completely
2
differently.
kiwi fruit a day.
For
skin health.
Yeah, I mean,
gut health.
I mean, even like their boyfriends have been around a lot recently as well. They've been in and around the family for a long time, but for them as well, same sort of thing. It's like talk about growing muscle, or the way that they can have more energy to attack the day. So it's almost like even messaging itself, and what you're consuming, everything comes back to hyper personalization. It's the only real way. I remember for years I was trying to get the girls to get into sauna, because I know the benefits that can come from that for them. Whereas I don't care sauna. I don't care about my heart health. You know what I mean? I don't care about that. But then one day they came home and they were like, actually, can I get in the sauna? And I was like, yeah. I've cracked them, you know. But it had nothing to do with me. It was once again, it was something that the benefits that were really important to them at that time showed up somewhere for them, and the message landed. So just once hyper personalization here is the real challenge, I think.
Well, I think on that you're absolutely correct, because one, everyone's gut microbiome is completely unique, so it's as unique as your fingerprint. So that hyper personalization is 100% what's going to work. Which is why I talk a lot about supplements with people, because everybody wants that silver bullet, and there are so many companies and so many influencers making money out of telling us that if we take this, it'll fix that. I think one of the most important things for health in general for everybody is that people become far more inward looking than outward looking, right? So if you can become much more in tune with your own body and listening to it and constantly checking in and having that kind of internal conversation, and less about what other people are doing or what somebody's telling you to do, I think that's far better pathway to go down for just overall health and well-being. And I think in this modern world with so much noise and so much information, we've really lost that ability to just reflect inwardly. And you talk about your girls, if we can teach our kids how to do that, I think they'll be in a much better space going forward.
Yeah, I couldn't agree more. It's part of why we exist at OStudio, really, is the space to step away and reflect and go inward, so that you can be more outside of that.
Yeah.
So,
And so you can make those hyper-personal choices for you because you know what's going on and you can feel it and you can understand it. And because life is really just a series of iterations, isn't it? We just continuously try things to see if they work or not. So we've got to have that real connection inwards to self.
Yeah. And then just to for kids, because we talked a little bit about kids today, like it's really just getting them to focus on fruits, veggies, and beans. Kind of what you said there.
Yeah.
variation.
Yeah, and I think exposure. So one of the sort of misconceptions that people have, and I had this as well, is that, you know, if you put something in front of a child, a food, that if they don't eat it, then you've failed, or there's something wrong. Simply by exposing kids to different foods, whether that's everyone sitting at the table and they can see that you're eating something different or you can try it. If they pick it up and touch it, that's exposure. If they smell it, they don't actually have to eat it first and foremost. And you just keep trying and you just keep exposing them to as wide a range of those different foods as possible. I think that's a really good place to start, especially with fussy eaters.
Yeah. Because, some of the stats you talked about before, and I've got them here from your website, but it also talks about celiac disease is now 4 times more common than it was 50 years ago.
Yeah.
You talked about those global cases of inflammatory bowel disease have risen by 88%. Like you have to think, things are getting worse, and so what's the change? And it's really it's not our lifestyle have changed, right? The food we eat, the stress we're in, the hyper engaged we are all the time, the pressure, all those things is what's really changed. If we zoom out from what does someone's life look like 50 years ago compared to now, and the food that kids have available to them now is it can be tough as a parent to try and make sure that they just want a bit of bread or your broccoli can go where it wants, sort of thing, and there is challenges, but I think that we don't have to complicate the answers too much, even for adults.
I think this is something that I'm so passionate about because we say there's so many foods, right? Are they foods? Right? So, there are so many food-like substances that we have available to us. Yeah. And one of the biggest, dupes, I would say, in the world is that the people who produce and market those foods have convinced us that it is our willpower that is the issue, right? There's an incredible BBC documentary by a guy called Chris Van Tulleken, which is called Irresistible, Why We Can't Stop Eating. And essentially, in the mid, I think, 1970s, you see a dramatic increase in obesity in populations all around the world at exactly the same time. And either, as he said, everybody just lost collective moral responsibility at the same time, or there's another reason, right? And essentially what that reason is the rise of convenience foods and ultra-high processed foods, which are, produced and marketed by some of the smartest people in the world to be irresistible to us, right? And everybody struggles, myself included, with this concept of willpower, right? That, it's my fault that I can't stop eating chocolate, or I can't, that I want to buy bags of chips, or, and it's such a fallacy. And there's a great book, and I can't remember the author's name, but it's called Willpower Doesn't Work, which I would highly recommend to anybody. It's got nothing to do with gut health, but it has to do with this concept of willpower. And one of the things that I am really passionate about, and I want the Gut Foundation to be in a position to change, is the regulation around marketing of unhealthy food products to kids. Because in New Zealand, our kids see 27 ads for unhealthy food products every day, and our kids have no way of differentiating between what's good and what's not, or what's real and what's not, I
think adults don't.
Yeah.
The time either.
Yeah, absolutely. And I think we need more protection for our kids around these sorts of foods, because if we do that, we absolutely affect health outcomes down the track.
Yeah.
And we absolutely affect the country's ability to, have a functioning healthcare system, right? So,
Ambulance at the top of the cliff. Yeah, I actually saw a really interesting, like we talked about the other day. It was a parody video of someone like, I'm going to show you how to make this. And so, how he always says, I'm going to show you how to make this, like, berry oat bowl that takes all that kind of stuff. And he said, I'm going to show you how to make an Oreo, a made-at-home Oreo. And obviously it was a comedy parody video, but he was like, oh, so you get petrol and you distill that down to this, and you pour that across this acid, and you add in all these chemicals to this, and then you put that on that, and then you bake that for 3 hours, and then you soak it in diesel for 4.5 days, and and it was like, and then you've got an Oreo, and you're like, if people, like that's, all we see is this blue shiny package with, and so it was just an interesting, I don't think there was any factual information to it, but it was concerning to how, like, I've never thought about that. Like, would you eat something if you saw, like, hey, here's how you make the exact taste of this, and all the things that go into, you look at those, like, you turn a package over and it's got like
all these numbers,
and it's like, Xanthia gum, and you're like, where does that come from?
I always say, if you look at the back of a package and it's got all these really long words that you can't pronounce and a whole list of numbers, pop it back on the shelf if you can, because the other thing with those foods is that they actually trigger what's called reward circuitry in our brains. So it's the part of our brain that had evolved to prioritize, high fat, high sugar, high salt for increased chance of survival, which we don't, have to deal with any longer. But all of these foods have all this added sugar and then added salt, so it balances it out, and that triggers that reward circuitry, and it releases dopamine, and that just imprints on our memory. And so even when we see the packaging, the shiny blue packaging or the McDonald's logo, we get this rush of pleasurable anticipation because we think, oh yeah, that's, and it just goes round and round. There was a really interesting study done by Tim Spector. Do you guys know him? So he has an organisation in the UK called Zoe, Z-O-E, and they are microbiome researchers, and they do a lot of work in this space, and they've got fascinating information. And he convinced his son Tim to go on an all McDonald's diet for 10 days. And Tim was at uni at this point, so he was like, this is great, free McDonald's for 10 days. And they found after those 10 days, he had lost 140 different species of gut bacteria, which was about 40% of his total gut microbiome in 10 days of eating McDonald's. And high diversity, so lots of good bugs in your gut, is linked to vitality and longevity and just general health and well-being, physically and mentally. Low diversity is linked to all kinds of cancers and diseases and really nasty stuff. So I think, there's such a lack, there's a poverty of information, right, that people have because they don't actually realise what this food is doing.
Everything you're talking about there, I couldn't agree with more. Like, if you think about back to the 70s, just, and not only marketing, but like finding research to support the fact that actually sugar's fine and this is all okay, and that these foods are actually healthy. That was like, it was widely accepted for a long period of time. So it's like ingrained in society, and so like having people like yourself and your organisation that are, working at that regulatory level to try and change some of this, so that people are more informed, and that. But I think because I agree with that, but I still think ultimately it still sits with the individual until those things are changed. They're outside of our control. Like we've got people like you to sort of make those changes and push those changes. But I still think it all comes back to that individual. And I know you mentioned around willpower. Like it's impossible sometimes. You know what I mean? And the amount that's been ingrained in us over a long period of time. But I still think for an individual listening, it's like they have to try and take that responsibility on themselves until those things are changed, because they can't influence any of that.
But they also, what we don't want is for them to feel ashamed if they can't, because it's the environment that they are. We all know how important environment is, right?
Absolutely.
And in New Zealand, we have what is termed an obesogenic environment, right? And one of the things that Chris talks about in his documentary is this idea of a commerciogenic environment, which is one that is geared to the marketing and consumption of unhealthy foods, right? And we look at the problem that we have with obesity in New Zealand, and obviously it's multifaceted, and you can't just point at one thing and say that's it. But the fact that we have no regulation really around any of this food, and we have very little information, but then we are putting the onus onto the individual and saying, well, actually, it's your fault.
No, yeah, I agree with you. I agree with you 100%. And because it's like your environment shapes 80% of the behaviours that you take.
Yeah.
So I understand that. However, you know, there's still a however. We can't change the environment. We can't change what's going on. We can choose to not engage.
We can
absolutely.
if we rise up.
Yeah, exactly. and once again, and that is important. But ultimately, I think what I'm trying to get at in a long-winded way is we all actually know somewhere that eating an Oreo compared to eating an apple, there is a difference in there. I think we know deep down, and you talked about, you know, like if you go inward a little bit, you sort of, we do know. Yeah. Once again, I'm not minimizing the importance of changing the way that works, and I'd love to be able to click my fingers and all of a sudden the marketing agencies, the funding is rearranged, and that we're getting real information that's going to be not ultra processed food and the microplastics all through everything that we've got going on. But really, we can't as individuals impact that quickly. What we can impact is the choices that we make every single day. And I know what you're saying around willpower. And I fail at it all the time as well, but I still think the responsibility, we all have to choose to take responsibility for our own lives as much as possible. You know what I mean? Like just saying like that needs to change. Until that changes, I can't do anything. I feel like it moves the control.
I agree with that, Tim. I think it's, for me, our messaging at the Gut Foundation is always about addition, never about elimination, right? And that's because people are just constantly bombarded with things that they that make them feel bad about the decisions that they're taking, you know? And we have so many people out there saying, you know, I don't eat this, or I don't drink, or I don't, you know, and that's great for that individual, right? But I think if we can focus more on not what we are doing necessarily wrong, but what we can add in, you know? So it's the responsibility for the individual, in my humble opinion, is that they focus on things like hitting their 30 grams of fibre a day, right? Don't worry about the Oreos or the Cheezels or the glass of wine or whatever, you know? Just focus on hitting your 30 grams of fibre a day, because that's going to tick all those boxes that we talked about. Try and eat something different, right, to what you normally eat. So if you go to the supermarket, is there something that's like a fruit or a vegetable that's on special that you would never usually buy, right? Just buy it and try it. Challenge yourself. So those things I think are within the power of the individual to do, and they're positive things, and then the rest of it just help the Gut Foundation.
Yeah, I get it. No, I hear what you're saying.
We will try and advocate for everybody, you know?
Yeah, I love it. I love it.
Yeah, I agree with you both. And so, I mean, like, if I'm trying to sort of wrap things up here and go, all right, what should people do, you know? Because most people listening, I'd say everyone listening, doesn't want to die or have someone close to them die because of, you know, a gut disease. And so the key things are, from my take, is review your poo.
Absolutely.
If you're concerned, get a check. Advocate for people around you to do the same. 30 grams of protein a day. Fibre a day, sorry. And then support the Gut Foundation.
That's a wonderful wrap up, really. Yeah. No, I think you've hit the nail on the head. I think I don't think I have anything to add to that. It's exactly what we want people to do.
Yeah, I think you've touched on a few other little bits and pieces as well, which I think are really, you know, as you mentioned, like your lifestyle impacts on your gut health, things like meditation or stress relief, and the impact that it has, the feedback going up to the brain, and how gut impacts everything. But I think if once again you strip it all back, it actually becomes quite simple. Like, and I know I don't like the word diet, I don't like the word healthy, because I appreciated it, but I think most people at some level understand what a balanced, healthy diet could look like, in some way. I think most people can understand that, doing a little bit of physical activity, however that needs to look for you, if that's golf on the week, that's golf on the weekend, but getting out there, it's all going to feed at getting good sleep, making sure you've got good people around you. The fundamentals stay the same, and the gut obviously plays a big part in that, and so, this has been really informative for me, because what we've ended up speaking about a lot is that bottom end, is the worst case scenarios, and that spectrum goes all the way up to high performance. Like if you want to be performing to your absolute best, there's things that you can do in this space. So my thing would be, think about it, figure out what you want as an individual, and you can there'll be absolutely things you can add into your life that will make it better, and you'll get better performance. So I think there's a real range that we've spoken about today, which is fantastic.
Yeah, and I think whoever's listening to this, there will be different things that resonate with different people, obviously, and different aspects of what we've talked about, whether that's, exercise, whether that's mindfulness and meditation, whether that's the nutrition side or supplements, or, and so I think you're right, pick the thing that resonates with you, and then learn everything you can about that, and implement and add some things, and then you'll already be doing really good things in terms of gut health, because, there is such a range, and it's really, because it impacts so many different things, it's such a holistic, topic and thing to focus on as well. Yeah. So,
Well, thank you for sharing. Thank you for coming in
Thank you
today.
for having me.
And thanks for all the work you do. Like I can imagine, your mum sounds like an amazing woman. She's passed the baton down to you, and you're an amazing woman doing some amazing things.
She'll be thrilled I mentioned her. So
yeah, absolutely.
Brownie points.
Yeah, well, I know that there's probably lots of things you could be doing with your time and career and effort and stuff, and you're clearly very intelligent and experienced and skilled. So to be putting your energy and effort into something that benefits so many people is something that maybe you don't always get thanked for. So from us, thank you very much. Keep doing what you're doing, and thanks for your time today.
Thank you so much. I really appreciate that. Thanks.
Thanks so much for listening to another episode of the OStudio podcast. If you enjoyed it, please hit the follow button wherever you're listening, and connect with us on social media at OStudio Global. Our purpose at OStudio is to make recovery and well-being as accepted, understood, and as practiced as physical fitness. To achieve this, we're building premium wellness hubs around New Zealand where communities come together to sauna, ice bath, float, recover, and so much more. All in beautiful spaces designed for everyday people. Check out ostudio.co.nz to find a studio near you, or explore how you could bring OStudio to your community. Own the moment.